carpet sorrow and tatty. This lounge ain't no fun. There's no insulation. The curtains are green and moldy. Yeah, I want a healthy home. Nice warm toes. Don't want to wear raincoats in the kitchen. Yeah, I want a healthy home with good ventilation. My situation is hairy. Ooh, oh, 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 oh. You, me, and those politicians aren't living in these third world conditions for a place where we spend so much time. It's strange how we accept that it's fine to live in a house that doesn't feel like a home, a house that too many of us have known, a house so dated and beyond repair, a home like the sky we truly don't want to be here. What we're asking for, it's a civil right, the ability to sleep in peace at night, knowing our sons and daughters, our sisters and brothers, our fathers and mothers can sleep under their covers, keeping in good health regardless of their wealth. Yeah, I want a healthy home. Nice warm toes. Wanna wear raincoats in the kitchen. I want a healthy home with good ventilation. My situation is hairy.
He aha tō mea nui o te a. He tangata, he tangata, he tangata. Kia ora. Nā whakatū aho. He Pakiha aho. Ko whaishiro whakainua. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Hello everyone and welcome to our presentation, Healthy Housing, Can They Fix It? This is the presentation of our 5-week long study. First, we're going to start by walking you through the current knowledge of how housing can affect health. Then we're going to introduce our study, the results we found, and apply it to 2 examples of heating and crowding in response to the NGZIP, the Random Fever Prevention Program. We'll have time for questions at the end and look forward to hearing your feedback. I'll now pass over to Raj and Noor.
Good morning. I'm Noor, and this is Rad. And we're going to start off by taking you through these 3 aspects of housing that influence health: poor indoor air environment, overcrowding, and home hazards. We will then take you through the story of our fictional public health family.
This is a picture of the mould in my flat. And this is my form of heating. At any one time, you can guarantee that at least one person in my flat will be sick. What worries me is that in New Zealand, my flat is considered normal. Our country's history of light regulation in housing construction means that many houses are poorly constructed, with nearly 2/3 of housing lacking adequate insulation. This poor quality of housing means that heating is both inefficient and expensive. From my experience, it's pretty heartbreaking to pay to heat your home, only to realise that it's still the same temperature as outside. This is one of the reasons why 1/4 of New Zealanders are in fuel poverty. This is where a household has to spend more than 10% of its income in order to heat their home. Fuel poverty means that New Zealand houses are heated less than any other country in the OECD. It should come as no surprise then that many New Zealanders, including myself, live in cold, damp and mouldy conditions.
There is strong evidence for the causal association between poor housing and poor health. 2 randomized control trials that looked at the benefits of heating and insulation showed that they are both good interventions to raise the indoor air temperature, reduce humidity, and reduce dampness and mold. Well, we all know that that's what heating and insulation do, right? But this study showed that those who got the intervention, as in they got their houses heated and insulated, reported better health outcomes. They didn't have to go to the GP as often, they didn't have to take as much time off school and work, and they had reduced respiratory symptoms.
The second aspect of housing that we looked at was crowding. When you live in a crowded house, you're in close and prolonged contact with numerous potential carriers of infection, so infectious diseases spread much more easily. We looked at 2 types of crowding. Firstly, structural, where there aren't enough rooms in the house for everybody who lives there. And the second was functional, where people crowd together in one room in order to keep warm. From the latest New Zealand census, we know that the absolute number of people living in severely crowded households has increased.
Sadly, this affects Maori and Pacific Islanders and those of lower socioeconomic status more than anyone else in our community. Pacific children are 11 times as likely, and Maori children are 7 times as likely to live in overcrowded households compared to their New Zealand European counterparts. These high rates are so worrying because there is strong evidence linking overcrowding to infectious diseases like pneumonia or rheumatic fever. One of the most shocking statistics that we found in the literature was that 21% of children presenting to hospital come from overcrowded households. And the majority of these admissions were for, you guessed it, respiratory illnesses.
The third aspect of housing that we looked at was home hazards. These contribute to 1/3 of medically treated injuries in the home. Home hazards include things like not having working smoke alarms and not having railings on stairwells. The cost of these hazards is predicted to be as high as $13 billion annually, which is nearly 3.5 times the cost of the road toll.
So now that we've established that these poor housing conditions have a serious impact on the health of New Zealanders, let's take a look at how this plays out in Ollie's household.
This is Ollie. She is one of 5 children who lives in this house with her mum, her dad, and her uncle. This is Mr. Smith. He's the landlord. He's been renting out this house for 10 years, from tenant to tenant. He owns multiple other houses, so he's got a lot to manage.
Ollie and her whānau are of Maori ethnicity. They have lived in multiple houses over the years.
We dream of having our own home, but we struggle to make ends meet. Even though weekly rent payments is a struggle for us. But I guess my parents didn't own their own home, neither did their parents. Nothing much has changed actually.
Did you know that the average cost of a house in New Zealand is 5.5 times the median income a Kiwi makes? This is regarded as severely unaffordable and puts owning a house completely out of the question for Ollie and her family.
My house is yuck. There's mold behind the bed and it smells funny.
I'm pretty sure our home isn't insulated as well. Just for the last week, the kids have been sleeping in the lounge just because it's the only room we can afford to heat.
And I crash on the couch. It's a hard night. There isn't enough room in the house for me, but I'd be on the streets otherwise, and I don't want to do that to me. We're a whānau.
So why not tell Mr. Smith?
We're worried he'll increase rent prices and fees to make repairs, or worse yet, evict us.
So why not find a better house? Research shows that Maori are 13 times more likely to report being treated unfairly when trying to buy or rent a house compared to their New Zealand European counterparts. Not only does this racism narrow down the housing market for them, but it creates a fear of the rental system for ethnic minorities.
In New Zealand, there's a shortage of housing, especially in major cities. There's a lot of demand, but not enough supply. This drives the price of rent up and puts the power in the hands of landlords such as Mr. Smith, rather than the hands of tenants such as Ollie's family. So where would Mr. Smith's incentive to improve his house come from?
I can easily rent my house to anybody, so what's in it for me?
And so, Ollie and her family go on renting this expensive house from Mr. Smith, prioritizing what they do with the rest of their money after paying for rent.
I've had to give up on things people consider necessities. Like, if me or Daniel get sick, we don't go to the GP. We have to save that money for Ollie and the kids.
So in summary, New Zealand house prices have been increasing over the last few decades, and we've seen a shift from ownership to renting. We've seen falling rates of Maori home ownership since 1991, with only about a quarter of Maori now owning their own home. So Noah, what's the big deal with owning your own home?
Well, Rad, there's clear evidence showing that homeowners are more likely to say, hey, I feel healthy. But the question is, why? Some studies have said it's because they feel more in control and have more security, and this might be due to a number of individual or environmental factors. Maybe they feel more stability and integration into their local communities, or maybe they have more money and more incentives to make improvements to their house, so they live in better quality houses overall.
But obviously, there's always going to be renters. So what's driving this higher health status of owners? Is it actually their housing conditions? If so, is it because owners know more about what makes a healthier home than renters? Or is it actually because renters do not have as much power as owners to change their housing conditions?
On to Harriet and Arden, who will tell you about the methods and aims of our study.
Rheumatic fever, asthma, meningitis due to poor housing.
44% of rental homes are in poor condition.
70% of children in poverty live in rental homes.
New Zealand homes are making us sick.
So from the literature review, it is clear that families that own their own houses have better health outcomes than families that rent their houses. But it is unclear as to exactly why this is. Because of this, we identified 4 factors to investigate in our study. Firstly, in Wellington, do homeowners actually have better housing conditions than renters? And if so, does this mean they have a better level of knowledge about how adverse housing conditions affects the health and safety of their families? If indeed they have the same level of knowledge, then how do they perceive their power or their ability to improve their conditions? And following from this, what are the common barriers that they face that prevent them from improving these conditions, and are these the same between the two groups? So alongside our 4 primary aims, we were also interested in the participants' opinions about which interventions may be implemented at a national level to help improve these conditions, and also their level of knowledge on rheumatic fever and how sore throats may lead to rheumatic fever. Now Harriet's going to explain to you the methods of how we did this, and we will show you a 5-minute video of our questionnaire in action.
So how did we go about answering our aims? Well, our main method was a questionnaire. We went out into the wider Newtown area to select our participants. Our only selection criterion was they had to have at least one child under the age of 19 years old living at home with them. By the end of our data collection period, we had 160 participants. 80 of these were renters and 80 of these what homeowners, and this is so we can have an equal comparison between the two groups for our data analysis. So our actual method, well, we based it around 3 main areas of housing features that affect health. These are indoor air environment, injury hazard, and crowding. And under each of these 3 things, we asked about 3 specific housing features. So under indoor air environment, we asked about heating, insulation, and ventilation. Under home hazards, we asked about smoke alarms, rails on steps and stairs, and a safe place to store cleaning products and poisons. And under crowding, we asked about structural, functional, and bed sharing. And then we asked our participants about each of the 3 areas. We asked about their knowledge of these, their ability to make changes under these 3 areas, the current home status under these 3 areas, and the barriers that they faced in trying to improve their home under these 3 areas. Next, we asked our participants about possible policies and interventions that could be implemented. This is so that we could get an idea of what they feel that they need to help them improve their home. So we asked about 12 types of policies and interventions. For example, we asked about a WOF for rental homes, home improvement subsidies like Warm Up New Zealand, other subsidies like energy efficient heating. Then we asked about rheumatic fever, and this is for our end user who are the Ministry of Health Rheumatic Fever Prevention Program. So we asked our participants how often they would take their child to see a doctor or a nurse if he or she had a sore throat, and can a sore throat cause rheumatic fever? So here's our clip to give you a better idea of how we actually did the questionnaire.
Hi, how are you?
Hi, I'm good, thanks.
My name's Ryan. I'm a 4th-year medical student and I'm doing a survey on healthy housing.
Oh, okay.
I was wondering if you'd like to be involved.
Yeah, that sounds interesting.
Cool. Have you got any children under the age of 19 living with you at home?
Yeah, I've got 2 kids.
Alright, great. I've just got this information sheet and consent form that you can have a read of and then just sign it at the bottom.
Oh, okay, cool.
Let's be outside out of the rain.
Yeah, it's very hot.
Okay, so I'll just start asking you some questions with this questionnaire now.
Yeah.
What school does your youngest child attend?
Newtown School.
Newtown School?
Yeah.
How old is your youngest child?
5.
5. What ethnic groups do you belong to?
New Zealand European.
New Zealand European?
Yeah.
Okay. And do you live in a house or flat which is rented from a private landlord, owned by you or someone else living there, a state house from Housing New Zealand, a council house from the Wellington City Council, or another housing situation?
I rented from a private landlord.
So you rent from a private landlord, great. Now I'm going to move on to the next section and ask you about how some housing conditions might affect the health and safety of your children.
Okay.
Not all of these conditions might apply to you, but you could imagine yourself in the situation. Okay. And to answer these each factor, I'm going to give you this show card, which goes from 5 being very important down to 1 very unimportant. So how important do you think heating your house is for the health and safety of your children?
I'd say that's very important.
Very important, so a 5?
Yeah.
Okay. What about insulating your house? How important is that for the health and safety of your children?
Very important. 5.
So a 5 again?
Yeah.
Okay, so now I'm going to ask you a few questions about improving conditions of your house. So I'm going to ask you about a few factors, and you might not need to improve these factors in your house, but just imagine that if you did need to improve those things, how easy or difficult would it be for you to improve those things? So how easy do you think it would be to improve the heating of your house?
I think that would be very easy.
So a 5,
Yeah.
very easy, great. What about insulation of your house?
I think that would be quite hard. So
Quite a hard
maybe
one.
a difficult 2.
Okay, so 2.
Yeah.
Okay, so now I'm going to ask you some questions about your current home.
Okay.
Alright. Do you think you've got enough heating in your house?
Yeah, I think so.
Yeah, you do. Okay. What's the main source of heating you use in your house?
A heat pump.
A heat pump? Is that the only source?
Yeah.
Yeah. Alright. So what do you think about a warrant of fitness on rental housing?
Yes, 1.
You think we should have that? What about a warrant of fitness across all houses?
I don't think that's applicable to my situation, so 4.
Because you rent?
Yeah.
Yeah, fair enough. So that's all the questions I've got for you. So
Okay,
thanks
great.
a lot for helping out with the questionnaire.
Okay, thanks.
So now you've heard from Arden and Harriet just a little bit about how we constructed our aims and constructed our methods so that we could sort of answer the questions we're looking at. So Dylan and I are going to talk to you a little bit about the results that we found. And so I'm going to be talking specifically about the demographics of the study. So sort of what our sample population looked like once we'd taken all the data and had a look at it. And then Dylan will talk to you about some of the other interesting factors that we found in our results. So first of all, within demographics, I'm going to talk to you quickly about what exactly we mean when we say renters and owners. So we had 80 renters and 80 homeowners in our study. And so when we refer to homeowners, these were people within the study that said that they or someone else living in the home owned that house that they were living in. When we refer to renters, there are actually 3 separate groups that we're referring to. So those who rented from a private landlord, those who rented state housing from Housing New Zealand, and those who rented council housing from the Wellington City Council. Another really important factor that we were looking to make sure that our sample was sort of representative of New Zealand is with regards to ethnicity. So what we have here is the percentages of ethnicities that people identified with through our sample population. So we have New Zealand, European, Māori, Pacific here. And what you can see here is here's our study in the green, and here's the most recent census data of the Wellington region and Newtown East and West. And what's sort of pleasing to report for us is that our study looks approximately similar to those census data. So what we can say is, it's maybe generalizable to the Wellington region and the Newtown region. Moreover, within ethnicity, as you've heard previously in the literature review, there's a smaller proportion of Māori and Pacific compared to other ethnicities that are owning their own homes. And this was represented within our sample population again. So here you can see the proportion of participants by ethnicity that are owning or renting. So you can see here that Māori and Pacific much more likely to be renters than owners, and more so than other groups. At this point, I'd like to present to you some qualitative statements that we gained from our report.
Double glazing is too expensive.
Warm Up New Zealand is fabulous.
For landlords, it's all about money, investments and incentives.
People need to be aware of the health impacts of housing.
It's too expensive to improve my home.
So the next thing that we were really interested within the demographics, as you heard from Arden, was we were really interested as to whether renters and owners differed in terms of their housing conditions, the actual housing conditions within their home. And with regards to this, we sort of looked at 2 different ways of looking at housing conditions for the people. Firstly, we looked at creating a score based on what people had said about individual housing conditions within the home. And then we looked at an overall score, so we asked people, how do you overall feel about your home? So firstly, let's look at the score that we created from the individual conditions. So as you heard from Harriet, we had these sort of 3 categories of indoor air, injury hazards, and crowding. And within each of those 3 categories, we asked about 3 things that might affect the housing conditions of your home. So for instance, within indoor air, this was insulation, ventilation, and heating. And what we did was we created a score from these. So I'll give you an example. Within indoor air, we asked people firstly, do you feel like you have adequate heating in your home? If those people answered yes, then we gave them a point. And then same for ventilation and insulation. So if people felt that they had an adequate condition in their home, then they'd score more points. So it would be a maximum of 3 points for each condition, and then we had an overall score that we calculated. And as you can see from the from this graph, we ended up with a higher overall score for owners than we did for renters. So owners ended up with a mean score of 7.9, and renters ended up with a mean score of 6.8. And probably what's more interesting about this particular scoring system is that we can see that the biggest difference between renters and owners was how they felt about their indoor air. So the difference in heating, insulation and ventilation. You can see there's quite a big difference between renters and owners within that category. So next what we talked about was we asked them about the overall condition of their home at the end of the questionnaire. So we asked them, how are you feeling about the overall condition of your home? And they were asked to rate it on this sort of scale here. So you can say it's excellent, good, average. And as you can see here, there's a much larger proportion of owners that are saying that their house is excellent or good in comparison to renters. And renters are much more likely to say that their home is average or poor or very poor. So from these two sort of housing condition frameworks, we managed to gain from the study that maybe in fact there is a significant difference in housing condition between renters and homeowners. So now I'll pass you on to Dylan to talk about some more results.
We know that there is a difference in housing conditions between renters and owners. But the question we have to ask ourselves is, what is the reason for this difference? Is it due to knowledge or power? If we look at this graph here, we can see that there is no difference in knowledge between renters and owners. If we look at the three different categories, indoor air environment, injury hazards, and crowding, we can also see there is no difference in knowledge in each of these three categories. This suggests that knowledge is not the reason for the difference in housing conditions, that in fact it might be due to power. If we look at this graph here, we can see that there is a difference in power between renters and owners, with owners having greater power to change and improve their housing conditions. If we look at the three different categories, we can also see that there is an increase in power for owners to change both indoor air environments, injury hazards, and crowding. Therefore, it's a difference in power which is the reasons for the difference in housing conditions. And this can better be illustrated by this graph here. On the x-axis, we have knowledge. On the y-axis, we have power. The red line represents renters, and the blue line represents owners. What this graph shows us is that as knowledge increases, there is a greater increase in power for owners. Therefore, for every part of knowledge gained, there is a greater increase in power for owners to change their housing conditions. So the next question we have to ask ourselves is now that we know that there is a difference in power, what is the reason for these differences in power? What are the barriers which prevents people from improving their housing conditions? If we look at this graph here, we can see that the main barriers for renters was landlord and money, and the main barriers for owners was money and personal choice. This suggests that if we are able to reduce these barriers, we can increase the power for people to improve their housing conditions. So the question we now have to think about is, what are we going to do to improve these barriers? What policies and interventions are we going to introduce to help reduce these barriers? We asked the participants what policies they thought would be best to help improve their housing conditions. And the top two mentioned between both renters and owners was subsidised insulation, such as Warm Up New Zealand, and other insulation schemes, such as energy efficient heating. What is important to note is that all of the participants felt that the policies and interventions that we introduced would benefit and improve their housing conditions, suggesting that government intervention is a good way to help reduce the barriers and improve power to improve housing conditions. So, as a summary, we have shown that there is a statistical significant difference between housing conditions among renters and owners, and that this difference is not due to knowledge, as it was equal among both of the groups, but in fact due to power. And the reasons for this difference in power is due to the barriers identified here being money, landlord, and personal choice. So, if we use government interventions and policies to help reduce these barriers, then we can improve power and improve the housing conditions in New Zealand.
So what do these results mean? How can we utilise what we've found out in our literature review and what we've found out in our study to make a significant positive effect to renters and reduce inequalities? I'm going to take you through an example to do with heating, and we're going to be able to see how we can use interventions to improve health. Nor and Rad in their introduction were kind enough to give us some information on how living in a cold, damp house with poor air environment contributes to that house being rated in terms of having poor living conditions. And we know that poor living conditions contribute to poor health. We know that people that live in cold, damp houses have a higher incidence of lower respiratory diseases, asthma, and asthma in more than one way actually. People that live in a cold, damp house can get have a higher incidence of new diagnosis of asthma and a higher incidence of exacerbation of existing asthma. And we know that living in a cold house puts you into a chronic state of vasoconstriction, which increases your arterial pressure, which means that you're at a higher risk of cardiovascular mortality. So it's time to turn up the heat. We asked renters and owners, the house occupants, whether they thought they were warm enough in their house. And you can see here that renters feel much colder than homeowners in their house. Homeowners enjoy a warmer house environment than renters. And renters are really feeling the burn, because not only do they have a colder house, the methods that they have to use to heat their house are much less economical, much less efficient. So you can see that we asked the house occupants to give us a bit of information about how they heat their house. So this here shows that renters, their main method of heating significantly is plug-in electric heaters. Plug-in electric heaters are very uneconomical. The amount of money that you have to spend to get heat out is very uneconomical. You put in $1 worth of power, you don't get much out. Homeowners have the luxury of having a much higher proportion of heat pumps. There's that Stephen Fleming ad for Fujitsu where he says you put in $1 of power and you get out $4 of power with a heat pump. So there's a huge inequality there, and that's not fair. We know that cold, damp houses lead to a poor housing condition, which leads to poor health. So surely if we improve this situation, if we bring in heating and insulation interventions, like subsidised insulation, like subsidised economical heat pumps, then we can remove cold and damp environments. We can improve health and conditions, and therefore we can have better health.
Warm and cosy in winter. The deadline is fast approaching to receive a government subsidy, and experts say hundreds of thousands of houses still don't have enough insulation. Daniel Faitawa reports.
As the cold snap sets in, this Auckland homeowner is looking forward to a warmer winter.
A bit drafty, these old houses anyway, you know, with a scheme. Thought, right, I may as well take advantage of it.
He's benefited from government subsidies for insulation under the Warm Up New Zealand Heat Smart scheme. But thousands of others will miss out on those subsidies from September, when eligibility will be means tested.
The new program, Healthy Homes, is about targeting at those most in need, those on low incomes, those with community service cards.
Under the current system, a subsidy of up to $1,300 is available for anyone living in a home built in 2000 or earlier. By the time the scheme ends in September, 230,000 homes across the country will have been insulated. But the new scheme for community service card holders will see just 46,000 homes subsidised over a 3-year period.
We have been advocating for many months with government to both keep the scheme and to make sure it's effective.
$350 million was pumped into the current scheme. That has been scaled back to just $100 million. The industry says that will see 1,500 jobs gone.
Until the existing...
So you saw from that video there how the Heat NZ insulation program is winding down. But if we look at the stats about that program and how effective it was, we've said it cost them $350 million to insulate 250,000 homes, and the research shows that that program had a net benefit of $951 million. So they spent $350 million and saved $951 million. Where did that saving come from? It came, well, one area where it came from was less people going to hospital because they're more healthy.
Okay. So now it's time to take off our hats and get down to the nitty-gritty. Again, what do these results mean? I'm going to look at crowding and rheumatic fever and what the implications are for our end user. The Ministry of Health and the Rheumatic Fever Prevention Program. So firstly, rheumatic fever. What's all this fuss about? Why is it so important? Rheumatic fever is a third world disease and it's at distressingly high levels in New Zealand. In 2012, there were 171 cases of rheumatic fever in New Zealand. The majority of these were Pacific and Māori children. This cohort of children, by the time it comes to 2020, will make up 28% of our overall population. So this epidemic shows no signs of remission. So to quell these alarming rates, cue the Rheumatic Fever Prevention Program. It's a throat swabbing program for Group A streptococcal infection, which is a known cause of rheumatic fever. Not only focusing on rheumatic fever, it focuses on the drivers of rheumatic fever, such as poverty and low socioeconomic status. These are linked to crowding, and this is what I'll focus on next. So household crowding is described as fewer bedrooms or less space than the defined norm for the number of people living there. Insufficient investment of social housing has contributed to the very high rates of overcrowding we have here in New Zealand. Our Lit Review team has showed that overcrowding is associated with a number of diseases, specifically infectious disease. So what are these rates of overcrowding in New Zealand? And I'm going to look at this in terms of ethnicity. So here, this graph shows us the proportion of participants that met at least one of our 3 criteria for crowding. The 3 criteria we used were structural crowding, functional crowding, or bed sharing. With ethnicity along the bottom, we can see that Māori and Pacific ethnicities have a markedly higher rate of overcrowding, with 37.1 and 38.5%, comparing that to the New Zealand European rate of 22.5%. Interestingly, these objective measures parallel the subjective measures that we carried out on our participants, when we ask them, do you consider your house to be overcrowded? So people have an accurate recognition of overcrowding in their home. Perception is definitely the reality. So this leads to the question, if people know their home's overcrowded, they know that overcrowding is affecting their health, then why are they not changing this? So, this graph here, I'll focus on Māori and Pacific again. We asked the participants the question, what is preventing you? These are the participants that have said that their house, yes, our house is overcrowded. So we asked them, what is preventing you from changing this? We found that in Māori, 45% said the main reason they couldn't change was because of money. 27% said it was due to landlords, and for Pacific, 22% said money. Interestingly, Māori and Pacific have a high proportion saying that personal choice was a factor. And although we cannot say exactly what personal choice means in this context, we can read into it, and it may be due to cultural factors. So when implementing interventions, we must make sure they're culturally sensitive. So again, how does overcrowding lead to rheumatic fever, and what is the implication for our end user? So, group-based streptococcus is a known cause of rheumatic fever. If you live in an overcrowded home, it is more likely you can spread group-based streptococcus from person to person. So it is plausible, and research indicates that overcrowding increases the likelihood of rheumatic fever. Now, going back to the rheumatic fever prevention program, this is what's currently been implemented. The aim is to stop the progression of group-based streptococcus leading to rheumatic fever. But we think it's more efficacious if we can focus on the primordial determinants of health, such as housing conditions. What we want to stress to the Ministry of Health is that we think these interventions can be made better by giving people the power to change these housing conditions. So how can we do this? We can improve the affordability and increase the number of rental homes, thereby not allowing landlords to dictate the quality and price of rental homes. We can improve heating and insulation by the subsidy schemes that Ryan has already mentioned. And lastly, just a note on children. Children are the most affected by rheumatic fever, and they have the least power to change their housing conditions. So I think we as medical students, doctors, other public health professionals, or just the general public we need to be advocates for these children. So I think we are responsible for keeping people healthy. And the truth is, health starts at home. The cold reality in New Zealand is that our homes are making us sick. We need to reduce crowding to reduce rheumatic fever.
So in our research, we asked renters to rate what their barriers to having a healthy home were, and we also asked them to tell us the interventions that they would prefer to have overcome these barriers. So that's what this table shows. It shows the highest frequency response for barriers and intervention, and the second most high frequency response. So you can see that the biggest two barriers for having a healthy home, if you're a renter, is your landlord and the cost of improving the home. And the renters said that the interventions they would prefer to have to help improve their home involve subsidies, which relates to cost, and tenancy rights, which relates back to your landlord. So we really need to, they need what they want really. The landlord tenancy rights thing, you know, as we saw earlier in that skit at the start, Ella and her family were too scared to ask Mr. Smith to fix their house because they were scared that if they did, he might put up the rent or kick them out, or if he put up the rent, they might be forced to move out anyway. So I think the renters are asking to have their rights written out into their tenancy agreements, and they're asking for perhaps the landlords to be more responsible to improve the conditions of these houses. And they also want subsidies. So they want the insulation subsidies we've talked about. They want the economical heating subsidy we've talked about. And I've already shown you that they work. So what are our recommendations? What can we take from this research and apply to policy? The interventions need to focus on improving power and self-ability, not knowledge and education, because we know that knowledge and education were the same amongst renters and owners. More heating interventions and subsidies. Don't scrap them, bring them more. More subsidies for insulation, more subsidies for heat pumps. And crowding interventions, because Sam's told you how crowding is associated with rheumatic fever. And in this country, rheumatic fever is epidemic. So the take-home message for today and from our presentation is that knowledge between renters and owners is not equal to power.
Yeah, I want a healthy home, nice warm toast. Don't wanna wear raincoats in the kitchen. Yeah, I want a healthy home with ventilation. My situation is hairy. Question time.
Okay, so now the floor is open to questions. Just raise your hand and I'll throw a point towards you.
Microphones? Oh, yeah, good.
Oh, yeah.
We'll have a go without the microphone.
Everyone got that voice?
Somebody. So wonderful presentation. Thank you very, very much. That was really good. You seem to have two things you're proposing, one of which is a change in tenancy rights and one of which is subsidy for actually doing things. So they have quite different, they probably have the same effect of improving a number of homes, but they have quite different effects as to who they help improve the homes and how they impact on a population level. The Landlord Federation, who I've managed to read their latest bulletin, they strongly advocate for subsidies on the idea that they showed a number of case examples where they had an average case, and the average rental price they managed to put up by 50%, and their return on investment for the little bit they have to put in with the subsidy was well in excess of 20%. So landlords are a big advocate of subsidies and improving the house that way. They're, of course, dead against anything that would be a warrant of fitness or an approach that might put the onus on them. How do you feel, from a population level, the benefits would accrue to health and people coming in of the two different schemes?
So just to clarify, you're saying how would compulsory information on tenancy rights and the tenancy agreement improve health, and then how would subsidies improve health?
Yes.
Yeah. So we think that the intervention of making tenancy rights kind of more available to tenants and just kind of getting them to know more about what their rights are will help to empower them to ask their landlords, say like, this isn't good enough, I want better insulation, I don't want to have mould on my ceilings, that kind of thing. So we think that by them knowing their rights, that will just help them to make those changes and ask for changes. And then there's a kind of a question coming. And then also subsidies. We think just because one of the second biggest barrier for renters was cost. So whether that makes the landlord more likely to implement those schemes, then that would help too.
Thank you for your question.
Sorry, just a sort of follow-on question from that really. So would you say that the existing tenancy rights are enough to allow tenants to get their homes to be more right?
Whoever answers the question, can you repeat the question so we can get it on camera?
So your question was, does the Residential Tenancies Act cover the same things that we're proposing?
Does it provide enough protection for those tenants to be able to pass?
So I think the problem with the Residential Tenancies Act is that many tenants don't actually, use that in their power because it's not compulsory for landlords to talk about this with their tenants. Or landlords don't talk about this with their tenants. So they don't actually know what they can ask of their landlord, and the landlord isn't obligated to, agree to changes. Does that answer the question?
Sorry, how many of you are renters?
The majority.
How many of you know what rights you should have in a tenancy tribunal dispute about heating?
I personally know nothing.
So I think the key point there was that we made at the start is that it would be a compulsory information sheet attached, and that's the intervention that lots of renters agreed to.
We have a question here.
Hi. Firstly, thanks very much both for the presentation and for the recommendations, which I think are excellent. As I'm sure you're aware, from this year on, Housing New Zealand and Wellington City Council, all of their as landlords, all of their properties are subject to annual warrant of fitness checks, so it's not a complaints-based process anymore. Say for argument's sake, I am a terrible landlord offering substandard accommodation. It's all of the things you mentioned, that all of the hazards, the overcrowding. I'm letting it all happen. What do you guys think? What are your recommendations around how we can incentivise me to register with Housing New Zealand or Wellington City Council and therefore be subject to those warrant of fitness checks? I'm thinking of things outside of subsidies for for heating, things that are easy for me. How can I be incentivised, do you think, to kind of join the system and accept those regular checks, which we know work?
Okay, so one person I talked to, she was from the Netherlands, and she said that one thing that they had there for their system was something called tier housing, which is basically that an institution determines the prices, like the rental prices that particular houses should have, depending on their housing conditions. So the incentive for landlords is, well, if my housing prices are determined by them, then I'm going to be encouraged to try and improve my house itself, so then I can get a good rental price on my property. Does that make sense?
It does, and I think that's wonderful, but we don't have anything anywhere similar to that here. We've got environmental teams at the council that don't have a lot of teeth. I'm just thinking this is largely, substandard private rentals are largely unregulated, and given that you've made such great recommendations so far, I was hoping you had some recommendations as to how we can incentivise terrible landlords to register. But that's a wonderful statement.
I think by just increasing the awareness of renters of kind of the warrant of fitness idea, even though their landlords might not be making the idea, but you're kind of raising the issues of what makes the house good and healthy for them, and then when renters are looking about what properties that they want to move into, they might be asking more questions about, does this have ceiling and wall insulation, more kind of ideas like that, just kind of think of. Yeah.
Thank you for your question. I think on top of that also, landlords do hold a moral obligation as well. No, I understand that's all about making money, but I think, yeah, morality should come into it.
Yeah, really great presentation. 2 questions. So the first one is, given you're nearly all renters, how did your survey results match up with your own experience as renters? And second, can you say anything about the generalisability of your survey results to the wider New Zealand situation? You did a good job comparing it to the greater Wellington region, but in terms of New Zealand as a whole.
Well, I think as far as you say, the first question was how would you feel about your personal situation in relation to what we found? So I'd say, in my personal opinion, it is funny coming, because we all come from Dunedin. You take it for granted that your house is going to look like that. And I suppose Dunedin's maybe a little bit of an interesting group because there's sort of like a cultural institution around it. But I think a lot of people do. They really take it for granted. And I had an uncle from Colorado who came over and he just couldn't believe the state that our houses were in, because they just can't have houses like that or people would seriously die. So so if that's your first question. Sorry, what was the...
About generalisability to New Zealand, your survey results.
So we know, particularly up in Auckland and down in Christchurch, there's a real problem with availability of housing. And so if anything, I'd say that the disparity might be greater in those areas. And yeah, I'd like to think that beyond that I don't have much more to add, but I'd like to think that it's pretty generalisable.
Question out the back.
Hi there, that was a wonderful presentation, thank you very much. I'd like to just take you back to a point that you brought up on your presentation but didn't actually elaborate on, and that was bringing about interventions that are culturally appropriate. We've got this element of the personal choice aspect of household crowding. And did you have any thoughts on how that could be attended to?
Just so I'm clear what you're asking. So you're saying we mentioned we've got to be culturally sensitive in how we can go about doing this. One option was so obviously, because personal choice is such a big factor for Māori and Pacific, one idea was that you can increase the sizes of the rooms in rental housing. So if people want to sleep in the same room because of their cultural needs, they can, but they're still sleeping far enough apart to stop the spread of group A streptococcal. But I suppose the one trouble with that is increasing the size of rooms then makes them harder to heat. So I think the point we were trying to make is that it isn't just money, and it's not just the landlord coming in. This personal factors is it's playing a huge part in it. And I don't think I've answered your question that well. But
I'll add something to that.
Okay.
So I think because personal choice was a big thing that, like, a lot of people said personal choice, there definitely needs to be more research to investigate what that was. So that was one of the limitations of our study, that we didn't ask them what they meant by personal choice. So that could be another opportunity for someone else to research what people mean when they say they overcrowd because of personal choice. And even going back to the 2 hands framework that we learned about in public health this year, the second part of it was, asking people what it is that they want and sort of basing your interventions around that. So yeah, that could definitely be something really important to look into.
Hi, I'm probably not supposed to speak, but on that issue, I think it's an interesting one that you've highlighted, Carolyn, that it's constrained choice. When you ask people personal choice, do you want this number of people in your house? The work in our group has shown that if the alternative is somebody sleeping on the streets, as you pointed out, or in a house where they living where they were very unsafe, then many families will actually take in someone to the house even though they know it raises stress level, and even though they know it's less, the hot water is likely to go cold and all those kind of things. There's more people in the house. So there's very strong research showing that all cultural groups like space. They like conviviality, but they like space. So I think your response was a very good one, that this is an area where we need actually more work to understand what people mean by choice, and what are the opportunities, how constrained is it, and what are the opportunity costs.
There's another question just there.
Thank you guys, that was really good. I've just got more of a food for thought for you and a comment rather than a question. I work for Sustainability Trust and I run a program called Warm Fuzzies, which some of you may have heard of, and we help families who are getting sick from their housing condition. And I see about 80 families a year. And a significant component of the program is actually to give advice to the families about low-cost practical interventions that they can do in their home to empower them. So I would kind of have to argue a little bit with your final summary that knowledge does not equal power, because for the families that I see, a little bit of knowledge about what they can do, like draft stripping and plastic window double glazing and putting in effective curtains, ventilating by opening windows, cleaning mould, all those kind of things, actually does improve their housing condition and the health of those families.
I think, yeah, some of those, but double glazing, I think many families.
Double glazing?
Oh, okay.
Yeah, so just low cost things that they can do. And we do find that even those things, in conjunction with getting the landlords on board and doing the big ticket items, actually does make a difference.
I would like to make a comment. I'm from Austria. Middle Europe, and in our neighboring country, in Germany, every house owner has to certify the energy consumption of the flat or of the entire house. And as a renter, you can ask for the certification. And this certification puts a lot of pressure on the rent, how much the owner can get for the rental, for the renting the flat, and it works fairly well, except in crowded areas like Munich, for instance.
Thank you. Just on that first sort of statement, food for thought thing. So thank you for that comment, and definitely value your opinion. But don't you think the fact that we've done a study about how knowledge doesn't equal power sort of shows that?
Well, I run this program and I've done the evaluation program from last season, and the families would find that all those low cost practical things have made a difference to their health of their families. Qualitative rather than quantitative data that we've got, but I can see you guys in my report and know.
That would be great, thank you.
How many people
know about plastic?
No, the families that I see don't until I go and do the home intervention.
That's what I'm saying.
Yeah.
How many people know about your trust? How many people know about the Sustainability Trust and that these things are available to them? Like, do they have knowledge of your existence?
We've got a referral base, so we get health referrals from Otago and Compass Health and CCDHB. But we've got resource constraints. I would love to grow the program and be able to help every low-income family, but we only have capacity to see approximately 80 a year. But for those families, it does make a significant difference.
Because I think our study focused more on knowledge of the association rather than knowledge of like how to intervene. So more sort of our association that we found was knowing about them. We had equal knowledge but difference in power, but not knowledge about the intervention. So that's a really good point. What we assessed actually in the study was a different type of knowledge.
Hello, hi. I'd just like to make a comment really just to support what you said, your final saying. Miranda, I think you may be getting slightly mixed up in the idea of just knowledge as a base, but what you do is actually an intervention. There's funding, there's resources, there's your knowledge translates into assisting families to help empower them. So I think what you do is an intervention. It's not just purely knowledge rather than handing a leaflet out, for example, and just telling people about what's available. You assist people to make changes, which is slightly different, I think, than just the knowledge.
Any other questions?
But well done, brilliant presentation.
Wow, Dylan, that was excellent. I love the song at the end. And thank you very much for bringing creativity back, particularly into this boring topic, right, Philip? Housing. I'm from the Otago Wellington, and we struggle, we suffer to make this particular topic interesting and fascinating. And thanks to your young and youthful energy, fantastic. Anyway, so just a matter of interest, how many participants did you interview who did live in provided housing, so council and Housing New Zealand places?
It's 15 in total.
Oh, 15. So it's in relation to the finding that you had about families choosing to have a lot of members in their household. I remember, and I just have to commend you on this, because this was when we started when we had the first meeting with you about the project in terms of exploring the qualitative component of this very sensitive area. And I think you've done it really well and presented it well, so thank you for that.
Thank you for those nice comments. Our song will be available on iTunes at the end of the week.
I just have a question. I mean, I really like the strategic recommendations you're making, especially around subsidised insulation and heating. Where does that information go from here? Like, do you start emailing politicians each week or pick it? Like, how do you get your recommendations out?
Well, there's a medical student group called MSGA, Medical Students for Global Awareness, and as soon as the election is over, we're planning on emailing politicians about the Wellington Fitness and housing campaigns.
I'm just a bit surprised that you might not have done that with the election, like before the election.
We did
No,
as
I'm
well.
not. You did? Oh,
Yeah.
cool.
Do you want to pass on to
Pass on to
Caroline?
Caroline.
We have the New Zealand leader of MSGA right here. She's graced us with her presence.
Hi, I'm Caroline Neeson. I think one of the points is that I did a research project same as these guys a little while ago, and we were asked to make recommendations as part of the project, but it's actually a big step from the results and analysing the results to then make recommendations. And it's only a 5-week project, and then these guys have to move on to something else. So I think there's limitations. My actual question, I have a question with you guys as well, but yeah, anyway. So Medical Students for Global Awareness is a nationwide network of medical students who are interested in issues of health equity in New Zealand and abroad. And this year we selected housing and healthy housing as an advocacy issue to work on. We're focusing on warrants of fitness actually, and because as a network, as a group, we think this is a great idea, based on lots of research that the guys up here have done. So yeah, prior to the election, we have done a little bit of work around engaging with the public and some politicians around this issue. Some of these guys were involved in a creative demonstration in town a month ago called Operation Housing, which is where these props come from. But it's also a lot, this initiative is largely about increasing our understanding of advocacy and our, as students and future doctors, our interest and ability to engage in these issues with the public and with politicians. So it's not all about the result, but we're really interested in the issue. And if you want to know more about us, you can find us on Facebook. And our campaign is called Healthy Homes for New Zealand. And we're going to try and keep going after the election and into the next parliamentary term as well. So, Yeah. Thanks, guys. My question for you, actually, there's one about warrants of fitness. When you ask people if they thought this was an intervention that, when you asked them about this, how many people actually knew about the idea? And did they know what it was? And were there any other limitations of your study?
So the way we assessed the interventions and policies is that we had the list of 12 of them, and so we asked, in your situation, would this following intervention help improve your housing conditions? And then they just said yes, no, I don't know, or not applicable. So we didn't really go into further whether they knew about it, but I guess from the 12 of us that did the interviews,
From my
a lot of
personal-
people, when we were interviewing them though, and when we said to them, would you want a warrant of fitness for rental properties, or would you want one for housing in general? I personally am not sure about the rest of the group, but I did have to explain, there was a subset of people which would say, oh sorry, I don't actually know what that is. And then a group of people obviously did know, but yeah, there were certainly people who really actually had to explain to what it was about.
It was very, very mixed when I did it as well. Some people who knew about it, people who knew about it seemed to be very passionate about it as well. Very, very, I think it's very, very positive, but then there were quite a number of people who were very confused. Yeah, so we had to explain that to them. But it's good, because that in itself is pretty weird.
Any other limitations?
Yeah. The level of explanation that we went into for that sort of thing was quite brief, because we had to make the questionnaire quite short so we could talk to people on the streets about it.
Yeah.
So those were kind of just more kind of skimming the surface into that, and also the amount of explanation that all the students gave for the questions and how they phrased the questions would have been different. We did have a statements before each section that was the same to try to make it objective, but there was still that variation in the delivery of the students and how they took the data.
Thank you, Caroline. Now, Michael Baker has a question.
Thanks. Of course, I want to congratulate you on a fabulous presentation and project, but I'm slightly biased. I had a really question about the wider social justice question, and I think it is interesting now that in New Zealand there's a sizable portion of the population who live in rental housing for their entire lives. It's not something like yourselves who move into rental housing for a period and will probably eventually own or will be in very secure long-term rental housing. So I'm just interested in your views about the implications of your work for the wider social justice question, and also, I guess, how society views the poor and those living in poor housing. Because sometimes the concept of the deserving and the undeserving poor, and a prejudice that low-income people may be poor, ignorant, and lacking enterprise, and therefore they're doomed and to some extent deserve poor housing and everything that's coming. And I'm just wondering if your project challenges that prejudice at all.
I think it does in some way, because we've shown that renters and owners have the same knowledge. So I guess it's not that they're kind of unaware and living in these housing conditions. They know what they want to improve to make themselves healthier. That's my first comment, I guess, about the social justice issues. I think it's hard to comment as a group, but I think personally, well, most of us would agree, I think that it's such a big health issue, and that kind of, if that's determined by what job you have or your kind of socioeconomic status, we don't think that's really fair for there to be such a big difference between renters and owners. And that, if you were kind of acting for the good of everyone, you'd increase the quality of rental houses for the renters.
And to further add to that, what you were saying about the poor people and then the well-off people, I think that you don't realise that, like you said, we're going to probably own our own house one day, so we're at an advantage because we don't have that baseline inequity, whereas the poor people, have a baseline inequity that they can't get out of. So that's something to add to the wide legal justice thing. It's hard for them to get out of it, as opposed to people who have advantages that can help them get out of it.
I think they're often trapped in a cycle of impending doom, so that's why I think these interventions are mental health, where it's found that people can't do it by themselves, so we need to do more as a general population helping people.
I think also if we relate it to our healthcare system, and I mean, we don't take the approach of, oh, they're poor, they don't deserve healthcare. We've got certain implementations within our health system, which means the vulnerable get healthcare. You know, under a certain age they get free primary care, ED, free care. I mean, why not have the same sort of standard for housing? Why not, you know, bring the standard up for those that are most vulnerable?
Yeah, I think definitely through a public health lens, just my personal opinion anyway, is that people's poor housing conditions is definitely not the fault of the single person, it's a failing of society as a whole. So definitely I don't think people should be treated as ignorant or sort of deserving of it. Any more critical?
Thanks for the discussion. Just wondering, in your surveys, did you have any discussions with people about rheumatic fever, and did you get any indication from people about their awareness levels?
We had an interesting result with that, in that there was the amount of knowledge that specifically Pacific Islanders and Māori had on rheumatic fever was very high. That they knew about the causal association, which was really interesting. I think, Sam, would you like to extend on that?
So we found that Māori and Pacific had similar, if not higher, rates of knowledge about. The two questions we asked them was, how often would you take your child to see a doctor if they had a sore throat? And Māori and Pacific ethnicities answered always a higher proportion than other ethnic groups. Yeah, so I think in a way that's showing that the rheumatic fever prevention program is working on a education level and helping people. But did you have something else to add?
Well, when you say that they were higher, the numbers are higher.
They were always like significantly higher. Like, kind of like 80% of Pacific Island people knew that a sore throat caused rheumatic fever, whereas other people were more down.
Also, when we asked the question, how often would you take your child to see a doctor or nurse, we gave them options: always, often, sometimes, never, I don't know. And overall, the whole population seemed to be aware that rheumatic fever does affect Māori and Pacific. So you'd have the New Zealand Europeans saying, well, like I might know that a sore throat can cause rheumatic fever, but I know this doesn't affect my ethnic group as much as Māori and Pacific, so I would only do it sometimes. Whereas the Māori and Pacific seem to be aware that in their population they're an at-risk population, and this is why they always need to take their child to see a doctor or nurse when they have a sore throat.
And that was a response across the board, wasn't it?
Yeah, we did have graphs showing this, but they didn't make
We have
presentation
written,
for some reason.
we've written a report on all our findings that have all our results in it, and we'll definitely send it out to whoever would like a copy. I don't know the results off the top of my head, sorry.
Yeah, it was significantly higher both Māori and Pacific in terms of knowledge did a sore throat cause.
And Pacific came out the highest over Māori.
So we will finish very shortly. Are there any more questions? Burning questions?
Sam?
Yes. Emily has something to say.
Just before everyone goes, as a group, I just wanted to, in front of everyone here, thank Faye Sherlaw very much for all the amazing hard work she has done over the 5 weeks. She led our group and was in charge and did an amazing job, and we just have a small something for her. And if everyone could give her a round of applause, just to say thank you.
Just a few other thanks to make as well. Thank my team because they all did an awesome job as well.
And we want to thank people from the Ministry of Health for coming along to our presentation. And we hope you took something out of that, and hopefully more from the report as well. Thank you everyone else for coming and showing an interest in the topic. It's a very topical
issue at the moment as well, especially coming up to the election and what parties plan to do afterwards as well. And a really big thanks to our supervisors, Philippa and Michael, for guiding us through the project. It was, it was a steep learning curve. Yeah, we learned a lot about housing and how to run a project as well. And Ellie and Jane, I don't know if she's popped in, but yeah, thanks you guys too. Lots of handy tips and for coming along to meetings. And yeah, thanks all for coming. We'll hang around for a few minutes afterwards if you have any questions for any of the speakers in particular. Thanks.